Hey everyone, we're just waiting for Lizette to join us. Hey Lizette, how are you?
I'm good. How are you?
I'm good. It's so good to see you.
Good to see you too. Happy Friday.
Happy Friday. I'm loving your top, by the way. It's so
Oh,
pretty.
thank you. Yeah,
Love
I just
this.
kind of wanted to add some color.
I know, I love it. I feel like we could all use that. In New York, it's like we just got through with snow, so I'm all for springy,
For
happy
the
color.
color, right?
Exactly. Well, thank
Oh,
you for joining us, and thank you to everyone at home for joining us. My name is Meg Storm, and I'm the editorial director here at Edit. And today we are in the final installment, which I can't believe, and I'm a little sad to say,
oh.
of
We'll have
our
to do more in the
we're
future.
going to have to. No, we
Yeah.
absolutely will, because I just want to keep talking to you. But this is
Yeah.
the final installment of this four-part series, where we've been comparing in-office and at-home treatments all month long. If you have kind of been following along, we've talked about microneedling versus derma rolling, and in-office and at-home chemical peels. We talked about LED light therapy, and I'm really excited that we're going to be talking about another great option today, which is microcurrent, and is another one that's really great to do at home. So I'm excited to get all your tips on that, Lizette.
Yeah.
And I'm thrilled to everyone watching at home that my partner in all of this has been Lizette Ludwig, who is a wonderful aesthetic nurse and injector and just all around skin expert based in California. And if you're not following her on Instagram, you should be. Her handle is at Lizette Ludwig _RN, and it's just kind of like a skincare and beauty lover's dream. I feel like I've gotten
Oh.
so many tips from you, and
Oh,
I feel
that's
like I'm
good.
someone who
Thank
like
you.
knows a lot, but I still feel like
I
I learned
love
something
that.
from you.
That makes me happy.
No, I appreciate all of your tips. So Lizette, could you just kind of introduce yourself and your practice?
Yeah, so my name is Lizette Ludwig. I have been in the medical aesthetic space now for over 12 years. And one of my biggest passions is skincare and non-invasive treatments and combining those type of treatments with injectables when needed. But yeah, we've started this a month ago and I can't believe
Yeah,
it's gone so quickly. But the more I talk about these type of treatments, and the more research that I do, it just really, we just know so much about it. And
yeah,
it's good to have these type of treatments for maintenance, because we
absolutely.
don't have to now go to the bigger type of treatments. Now it's just nice that we have these non-invasive treatments that we can start early on.
That's what I was going to say. You really can build them into your routine at a pretty young age and maybe ward off some of the things that you might have needed
Exactly.
bigger treatments for down the line.
Exactly. And it could prevent you from needing some of those bigger treatments early on in life. So
Yeah.
we have so much at our fingertips now.
I know, it's amazing. And I think the fun part about this, and I feel like what we've learned through this series, is that a lot of that stuff is available at home. And it's not just, especially in
Yes.
these COVID times, about having to necessarily visit a professional, which is really exciting.
It is. It really is. And I think that's only going to grow in the aesthetic space. Even like, I think we're going to see so much growth in that area, these at home type of treatments. I think we're even realizing that we can trust our patients with so much at home.
Yeah.
So there's things that we can actually give patients where, like for example, the chemical peels, being able to give them at home steps and things like that they can do
Yep.
at home and they don't have to be in office. So
No, I
I'm
remember
excited
you
for the
saying that.
growth in that area.
Yeah, for sure. And if you have missed any of the previous conversations that we've had, Lizette did a great explainer on chemical peels. Everything's available in our IGTV, so be sure to check it out. But today, like I said, we're deep diving into microcurrent. And while this is generally safe and effective for a lot of skin tones and types, we always recommend that you consult either with an expert or a dermatologist before introducing anything, just to make sure that it's right for you. But to start, Lizette, can you kind of overview what microcurrent is? I feel like what I'm most excited about is the fact that you kind of get an immediate result, which is so unusual with
It
treatments.
is it is nice. Yeah, have you ever had microcurrent treatment? Like a
Not
professional one?
not professional. I've just done at home.
Yeah, it's pretty amazing. Even the at home though. I was
Yeah.
pretty amazed with, the results and we'll go get into the NuFace, but the at home technology is pretty good for these type of treatments. So microcurrent really helps with it helps with facial tightening, toning, It helps with just overall circulation in the skin. So, you know, in return, it's going to help with those fine lines and wrinkles.
Sure.
So think of it more as lifting and toning, and it's just like a workout for your skin, it's working out the muscles in your face, you know?
It feels like it's kind of like the gym, but for your face and without
It
a lot
really,
of
it really does. I remember the first time I did it, like you do feel a little bit of a zinger at first, you know, and I was like, oh, I didn't know what to expect. And then it doesn't hurt at all. It's painless. But you do feel something, which I think is good because it makes you feel like it's doing something.
It's doing something. I feel like
Exactly.
I've seen some fun before and afters on social media where it's like half the face is done and half isn't. And it's like you see the lift on the side of the face that's been done.
Yeah, you really do. And it really is technology. It's been around for a long time, and it's been used to treat like soft tissue injuries and chronic conditions. And, you know, like being in aesthetics for so long, you find out that a lot of these treatments were used for medical purpose, and then they kind of roll into aesthetics because they find that, you know, patients are getting other benefits from doing these type of treatments. But the intensity of treating a medical condition versus treating, you know, an aesthetic type of treatment, it's different. So there is more power in those medical treatments.
That makes sense.
Versus doing, you know, even if it's a professional microcurrent, you're not going to see the intensity isn't as intense because also muscles are different in every part of your body, and face is different than like, you know, your glute or whatever areas you're treating. So yeah.
That makes sense. And to anyone watching, if you guys have questions as we go, please feel free to drop them in the comments or use the little Q&A button. We'll do our best to answer them. But Lizette, in terms of the parts of the face that you treat, is it kind of the contour areas or does it go all over? How does that treatment kind of work?
I mean, you definitely, yes. And there's, you know, these treatments are done by estheticians. So typically, I have to be honest, I've had microcurrent treatments, but I've actually never been the one giving the treatment. Because these treatments are typically done by medical estheticians. So, but yes, they do treat the muscle, and usually they're going in an upward motion. And there are treatment areas, but usually it's kind of in this lower face and in the forehead area. And it's safe. And in you can do the under eye area. You can also treat like around the mouth. There's just, it's all about intensity and level, you know, of how much microcurrent you're putting in that area. But there's different type of technologies that they use there. If anyone has had a microcurrent, you might notice that some people put these gloves on, the estheticians, they put these gloves on. Those are supposed to be one of the best treatments. I really don't know exactly why, but the estheticians prefer the ones with the gloves versus the devices. I don't know if it gives a little more energy or you're able to really kind of work in that microcurrent with your hands versus a device that's a little more stiff and only lets you kind of get to a certain area. But there are different devices on the market. It's just, I think it's just what your esthetician prefers.
That makes sense. And so it's usually part of a facial treatment, right? So it's not just like you're just getting the microcurrent. You're kind of getting a facial like you normally would, and then it's like an add-on to it.
Exactly. So personally, I've had like an oxygen facial. So you go in, they cleanse your skin and kind of prep you as to whatever treatment they're going to do. But let's just say they're just doing a basic, most likely what will happen is you'll get your skin cleansed. And I feel like estheticians are so good at just kind of even just getting off your I just realized,
you're good.
Am I back on? Okay.
Yes, I see you.
So it always feels so relaxing and it's so good, even when you're getting your makeup off, you know?
Just like, so they have the most magical hands on the face.
They really do.
Like,
they really
for
do.
that reason alone, it's worth getting a professional facial. Just totally rub your face.
I totally agree. So the cleansing is step one, and then step two is exfoliating. You know, they'll exfoliate a little bit, and that's where you can combine it with a hydrofacial, an oxygen facial, things like that. So they'll do the exfoliation part. And honestly, you can even do an LED light treatment before or after, whatever the esthetician prefers. And then you want to do the microcurrent. You can combine it with other treatments, with facial type of treatments. Like I wouldn't combine it with a medically invasive. Like if someone was having microcurrent, I would probably not do Botox on that day. or even filler. Like,
Yep.
you know, when you're kind of really getting into those muscles, you want to just treat one thing at a time. So if you're just combining it with the facial, I think that's a great idea.
Awesome.
But if you're combining it with other things like lasers or things like that, I don't recommend that.
Okay. And then in terms of who it's safe for, it's good for all skin tones, right? This is one of those
All skin tones,
fine for
all skin
tones.
types. Yes, it's safe. It's a very safe treatment, but it does fall into like into the category of like a detox treatment.
Okay.
So you could essentially feel a little tired or sleepy, or you know, if you've had an aggressive treatment, you can feel a little, maybe run down a little, and that's completely normal because it's considered detoxifying.
Gotcha.
Maybe almost like a massage kind of, where you feel a little like relaxed. That's pretty normal, but they medically they recommend that pregnant women can't do anything. It's
pretty much,
it's not fair because that's when you need it the most, you know?
Yes.
But yeah, pregnant women and also anybody with heart conditions, because of the electrical current, they just don't recommend it. So those are the only, other than that, microcurrent is a very safe technology and treatment for all skin tones and all skin types.
And then we obviously talked about the immediate benefits, but it does have longer term benefits as well with kind of consistent treatment, right?
Absolutely. And a cumulative treatment is ideal, you know, so maintenance with these type of treatments. So they, you know, if you go in and you have a medical or a professional type of microcurrent, they might recommend 10 to 15 treatments.
Okay.
And everyone is, I found that everyone, it varies. It could be once a week.
Yep.
It could be once every other week. So you just kind of have to go by your provider's, you know, what they prefer to do and what they're recommending.
That makes sense.
But anywhere, usually it's 10 to 15 treatments, about 1 to 2 weeks apart. So you are going in the office quite a bit. You know, it is a lot, but you will notice the results. Like you said, they're pretty immediate. So, but within a couple of weeks, you'll notice that it just doesn't look as good. So it kind of gets you to go in again, because it's like working out, you know, you work out, you immediately will see the results in your muscles, you know, but if you don't continue to work out, those results will go away. So
it really
microcurrent
kind of training.
Yeah, exactly. It's very similar in that type. So after you complete, let's say you do the full 15 treatments. After you complete your treatments, you know, your esthetician is going to recommend a maintenance. And that's when maybe these at-home devices really will start, you know, playing into your beauty routine, because, you know, you can kind of decide, do I want to go in and have full another, maybe every couple months or so, or I can do this at home, you know?
Yep. And so on the at-home side, I know you have a NuFace, right? Which I feel like is one of the kind of
I have I have a NuFace, and I've had it for probably the last couple of years, and I love it. I also have the body one.
Oh, that's cool.
I wish I was more consistent with the body one, but you know, I've used the body one on my face as well, because it does have a little bit more current, you know, the microcurrent.
That makes sense. Yeah.
But they're great. It's just amazing. Like, even the first time I used the at-home one, that's when I felt the little zing, and I was like, oh my God, this really works, you know?
It does something. Yeah. And actually, speaking of kind of the zing feeling, that is kind of where the conductive gel that's used comes into play, right?
If you don't have enough conductive gel, you'll feel it.
So
it comes, all the devices have this, sorry that I'm turned around here.
No, you're good.
They have it, like, it's a gel. I can't get it out of here, but.
I have one. I have the ZIIP at home, but I have the gel from ZIIP.
So it's the same as like ultrasound gel.
So people
there you go.
See. Yeah.
And it's pretty thin. It's a pretty thin layer, but the first time I put it on, I don't think I had enough, you know, and that's when I felt the zing. So if you don't have enough of the conductor gel, you'll feel it a little. That's what it serves as a barrier for your skin and the device, you know. So you want to make sure that you put it on read the instructions. Ideally, with these at-home devices, we do recommend FDA approval on the devices, because there's so many on the market now. Yeah, there are. So I would really look for like NuFace. There's a couple other ones that are. I believe you have one as well, right?
The ZIIP one is FDA cleared also. Yeah.
So I do think that that's important with these, because they really are doing something. And if you want to make sure that they're doing what they're supposed to as well. So the gel is the same type of gel used for an ultrasound that you're having in a medical office. So it really, you know, it does its thing. It does its what it's supposed to. It serves as a barrier between your skin and the actual device, and
Yep.
it does protect your skin from anything that could, like, you know, you don't want to have to feel it if you don't want, if you're just
Absolutely.
doing it without the conductor gel, you definitely will feel it, and it could be pretty uncomfortable.
And I also
And it
feel like
won't glide either.
that's what I was going to say. It's not going to be as easy of an experience to move it around your face.
Exactly.
And so when you're doing your at-home version, is there kind of a specific way that you do it, or is it just, again, kind of with the upward motions?
I do the upward motion. I just always make sure that my face is clean.
Yeah.
So that's the number one, is making sure that my skin is cleansed. And if you want to do a little exfoliation at home, you can. So you can do one of your exfoliation pads, but I do recommend that you take off the solution. So if you're doing exfoliating pad,
Okay.
leave it on for 10 minutes or something, then just do a gentle cleanse. Put on the conductor gel, and then yes, you want to just kind of go in an upward motion. And then around the eyes, like NuFace has devices for the eye.
Yeah, that's what I thought.
With this one, I would just, if you just have one, it's okay. I would just kind of keep it at the orbital rim.
Okay.
You know, just
Makes
keep
sense.
it at the bony area where you still feel your bone here. I
Yep.
would keep it there and just, you know, going up. Upward motion is always the best. You know, just upward motion in this way.
Yep.
And you probably want to switch hands here, and then you do the same thing, upward motion.
And you're really then,
So,
I
yeah.
feel like, maximizing the detoxifying piece of that, because I feel like that's like all the lymphatic drainage.
It really is. It is all the lymphatic drainage. So I think that's why people are, you know, they feel a little relaxed, which is good. You kind of feel
Yep.
like you've had a spa treatment, you know?
No, I feel like it's one of those things that it's kind of like we were saying with LED, it's like worth treating yourself to, because it really is that kind of self-care moment.
And LED and microcurrent are treatments that you can combine together. You know, they really are, because they're and I know we're not talking about LED, but they do combine. This is more for facial toning and tightening.
Yeah.
And LED is just more for overall, like, uneven skin tone, you know?
Which is, I feel like, usually you're trying to address both anyway. So, like, might as
exactly
well marry that.
So with the microcurrent device, you won't really notice anything in facial tone, meaning like the skin tone, you know? Yeah. But for tightening, you will.
Which is really exciting, because I mean, honestly, I think it's often called kind of like the non-invasive facelift, because I really don't know how else you get that kind of tightening effect without surgery sometimes.
There is a treatment on the market now, and it definitely goes a lot deeper than microcurrent. It's and it's ultrasound technology, ultherapy.
Okay.
We don't have to get into that, but there is kind of, so I would say microcurrent, ultherapy, and then the next step would be
facelift. Okay.
Yeah.
So you have like one kind of in between option before you commit to.
Ultherapy is much more uncomfortable than the microcurrent. I will tell you that. I've had both.
Noted.
And I'm like, oh my gosh. Yes, microcurrent is very tolerable. It should not hurt. It should feel like a spa treatment even afterwards. You should feel relaxed. So it is one of those at-home treatments that I think definitely worth it.
Do you like to do it in the morning just because then you're kind of enjoying that lifted effect during the day, or does it not really matter?
I wish I had time.
I know.
Yes, that would be ideal. I wish I had time in the morning, but I don't. So I'm typically do it at night. That's when I do the microcurrent. But
yes, do you wash off the gel afterward?
I do.
Okay.
Yeah, I do. So if I do it at night, I'll just cleanse. I put the gel on, and then I do the treatment, and then I take the gel off, and then I'll do my skincare. Yeah.
And then you can.
So it does add like a 15-20 minute step to your skincare routine, but I think it's worth it. I feel like it's worth it if you have the time, and if you're really into these beauty treatments. I really think these type of treatments that are offered at home now.
Yep.
You know, I think it's worth it.
And I feel like it's one of those things, we've kind of written about this before, to your point about maintaining your skin. If you are someone who regularly is getting professional treatments, this can be a great thing to kind of either prolong the effects of those treatments or just complement the effects of those treatments at home.
Exactly. And at some point, some people will say, like, what age? I'll have patients, what age should I start these type of treatments? Well, like microcurrent, you can start early. Like, I would say these type of treatments you can start as early as 25, honestly, because that's when your collagen starts breaking down
badly.
Yeah, so if the earlier the better with these they're non-invasive, they're not breaking your skin, they're easily tolerated, no downtime. So I do think that these type of treatments should kind of be like, you know, I think they should be offered for a younger generation. I don't know if there's an
Absolutely.
actual number, but at some
Yeah.
point they probably won't, you know, they won't do the trick anymore. You know, you might
You're
have
going
to
to
step
need
it up to like an old
the old
therapy
therapy.
treatment or something like that.
That
Yeah.
makes sense.
So I think take advantage of these treatments if you're young, and I mean, anywhere between 25 and 40 is probably, you know,
Yeah.
a good place to start.
That makes sense. No, that's great. And I feel like, again, it's just any little bit you can do on the preventative end might save you some of the kind of corrective stuff
In the
down
long run. Yeah,
which
I
I think
agree.
is always the goal. Would you say, I feel like microcurrent is one of those ones where when we get back to having events and weddings and all that kind of stuff, it feels like one of those great treatments that you can kind of do in the lead up to a bigger event.
You can. You definitely can. And if you can plan ahead to get a few
Yep.
before, that would be ideal. But even one, because the results are pretty immediate, you know, if you can do it a couple days before, it's pretty amazing. But always, you know, try to plan ahead before an event. That's always my advice, is planning ahead, even if you can, you know, but microcurrent is one of those that there isn't downtime. So even if you did one, I think you'd be happy with the treatment.
No, that's great. And then we had a question come in earlier, I think just about facials in general. And do you have a kind of a general recommendation in terms of someone who might want to get a professional facial regularly with or without microcurrent, kind of what that cadence could be?
You mean like how often, or
how often you would like recommend someone go?
You know, facials are, I mean, because there's so much on the market, so it can get overwhelming, because it's like, oh my God, there's this treatment, and I just want a facial, you know, because what happened to the good old facial? But I think now these estheticians are offering so much more. They're like offering the microcurrent treatment. Yep. So find an esthetician in your area. If you're following me, you can always reach out to me. I know a lot of estheticians in different states as well, so I can always make a good recommendation if you reach out to DM me. But a lot of times the estheticians will recommend, you know, you should do 3 to 5 treatments of this facial. So they might have to customize it for you, and that might mean, I love hydrofacials. I don't know if you guys have ever had have you had a hydrofacial?
Yeah.
So those are amazing. And I've had that combined with microcurrent. So that's a treatment that really exfoliates, gets all the dead skin off, and really brightens up your skin immediately. And then you can do a microcurrent right over for the tightening.
Which is awesome.
I really think, and I think that how often, I mean, you might want to see your facialist, like, depends. If you have an actual concern, like if you're breaking out, you might have to see her every 3 weeks, you know? But if you're just going in for a normal facial, maybe every 6 to 8 weeks is okay.
And I feel like, to your point about building that relationship, because I think once you might need an initial kind of series of things, but then to your point, just becomes that maintenance of, you know, what your skin needs seasonally, or what kind of changes here and there, but like you'll have someone who's really focused on your specific skin consistently.
Exactly. And, you know, there's different types of providers. Like there's estheticians, and then there's providers like myself, like nurses, and PAs, and then there's doctors. So you kind of, if you think about it, it's, you know, estheticians treat more of the surface of the skin, and then we might go in with deeper treatments, and then the doctors might be the ones that are doing the really invasive treatments. So, you know, you just kind of have to I think starting with an esthetician is a great idea, because they have so much knowledge on the skin type, skin tone, quality. They really do.
And I feel like on skincare too, like I just feel like they always have, I mean, I think for me, I used to struggle with acne, and it was one of those things where just a really good esthetician that I saw a few times, like just transformed the way I thought about my skin, and like had those tips to really just make you realize kind of what's causing it, and what you can do to treat it, and not in an overly aggressive way of like put a bunch of benzoyl peroxide on your face, like just really thoughtful ways to take care of your skin.
They do. It's their specialty. They specialize in really just how to care for the skin. And a lot of these estheticians are into like holistic practice too. So they'll ask you about your diet and all that stuff. It matters so much, you know, lifestyle and all that stuff. So
No, and I'm sure it even matters, I mean, for your practice also, like it really is meant to be holistic. Like it's all well and good to treat the skin, but if you're not taking care of your body, if you're not taking care of yourself, it's really only like kind of,
it's actually my passion.
Yes,
it really is my passion. It's hard sometimes, because you do have patients that come in and they want a quick fix, you know, and we do have things that can make a quick fix, even like a microcurrent treatment. It can, but like if you come in and want a quick fix, you're going to say, oh, it was good, but you're not going to like love it. Do you know what I mean? It's when you
Totally.
commit to these type of treatments and when you go on a deeper level, you start talking about lifestyle changes and things like that. That's when all this stuff really kind of connects, and it just becomes like a part of you, you know?
Absolutely.
And I think it's all like together. It's the diet, it's the lifestyle, it's, you know, the maintenance of all this stuff. So it's just like a holistic approach in how you're treating your patients.
Certainly.
But the quick fixes are there, and that's nice that we have them.
Yes.
But for long term, you know, in order to really kind of love these type of treatments, you really have to think of it as like a lifestyle.
And do you find that more of your patients are receptive to that maybe than they were at the beginning of your career? Like, has the mindset changed the way people think about these things?
It takes time, you
Yeah.
know, it does take time. It's like, and some people will just, they're just not, that's just not their thing, and they just
Yeah.
probably won't be into it. And there's, you know, and that's okay, because there's
That's
providers for that. Yeah, that's okay.
Yeah.
But for me, my patients, like, we always, maintenance is like my number one thing that I talk to about them. So it's like, as they continue to see me, they kind of learn that like it's just kind of a part of my process, you know, and
Yep.
they kind of learn, and they, you know, and if we're a good partnership, then it works out,
It
you
does.
know?
Yeah.
So yeah, I think there's providers for everyone. And for me, I think my patients and my clients know that for me, it's like a long-term type of thing. Like, it's like, we're
Absolutely.
going to make a plan for probably a year. It could change, but that's the plan. You
And
know?
then it kind of gives you that something to like reach for, and everyone's kind of knows what they're working towards in terms of like what people are doing at home, what you're going to be doing for them when they see you. Like,
Exactly.
I feel like it just kind of gives some balance and some structure to something that, to your point, can
Yeah.
feel really overwhelming because there are so many
It is,
treatments.
and that's why I like to spread it out, because sometimes
Yep.
when you like talk about things like, oh my God, wait, I got to do laser for this, a microcurrent for this, and then
Yes.
like Botox for this, and it can get really overwhelming. So it's like, let's just do one thing at a time. Let's talk about skincare first, and then
Yep.
if we want to address the wrinkles, we can do some Botox, and then if you want to do your skincare, I'm going to refer you to, you know, to talk about microcurrent treatments.
Yep.
Or whatever it may be. But it's really all like collaboration within
Absolutely.
the industry. Yeah.
Everybody has to work together. No, I love
Yes.
that. I wish I lived closer to you so that I could like, you could like
I know, I wish you did
dissect my
too.
skin.
I wish you did too.
Well, thank you, Lizette, for everything, and for today, and for the last several weeks. This has been so much fun to work with you on, and we're definitely going to have to do it again.
I would love that.
I would love that too. So for anyone watching at home, if you missed any of this or any of our previous weeks, like I said, they're all available on our IGTV. So please check them out. Please follow Lizette. She truly will answer your DMs and is just like the biggest fountain of knowledge there is. So at Lizette Ludwig _RN. And we also have some articles up on edit.com where we dive deeper into all the topics that we've been talking about. So you can kind of see the written version of that, and we embed the videos there as well if you want to watch there too. So thank you to everyone who's come on this journey with us. Thank you, Lizette, for being here. And we'll see everybody soon. Have a great weekend.
Bye, guys.
Bye,
Thank
guys.
you, May.
Thank you.
Bye.